Insertion of the OCTOwatrix is the most challenging part of using the OCTOwatrix primary. I'm going to go over a couple of the things that might help in this situation. First and foremost, this is really designed to be placed by hand. You really can't place it using cotton pliers or any other tool or instrument. And that's merely just because it's so flexible that it's very challenging to do without placement by hand. So in order to do that, step one, we have to get this precision tip below that embrasure, below that cut margin of the proximal box. And so when we place that, it's going to go below that area. That's really critical. You don't want to get it stuck up inside the box. So getting it below that area. Now you have to make sure that you support the matrix with your finger. So I like to, kind of have it almost like where it's completely along this finger, and notice the tip of my finger is kind of touching the adjacent tooth, and I use it to gently slide it in as I'm going across. So that support of the matrix, because it's too flimsy otherwise, it just flexes, is really critical. Supporting that matrix as it goes in, and then when it gets to this certain part, kind of about right here, see, first I've got it kind of angled down into that sulcus, but at this point it's going to hit the lingual gingiva, so it's really important to kind of push down gingivally on this handle, not just the handle but the whole watrix, to be able to get that tip to pop up on the opposite side. Especially on the maxilla, it can be challenging sometimes to get this tip to pop up in the right spot. So this is really important, once you have it kind of at this position, that you rotate the entire handle down to get that tip to pop up on the opposite side. I'll show you on distal insertion. So first of all, you have to imagine, we're working in the back of the mouth. This is pretty curved originally. It's designed for all sorts of, smaller teeth. And so I'll bend this back. Bending that back will kind of open it up for these larger molars. And then it's the same thing, but instead of using my first finger, I'm now using my thumb to support. So you see how my thumb comes here to support it as I'm inserting it? And then again, I'm pushing gingivally to get that tip to pop up on the opposite side to complete. And I kind of want to aim where this is right in the middle, not necessarily all the way to the hilt, or just right here at the beginning of the OCTOwatrix, up towards the marginal ridge former, but right there kind of in the center. That's going to give you your best restorative result. And then it's really cool because, you've got the cheeks and everything here in the way, so you can just push this to the back of the mouth, and then once it's pushed to the back of the mouth, you can remove it from there. You can also use the pinch technique, but pushing it to the back of the mouth really works well, and then you can grab it from there. Now, sometimes if it's a really small mouth, then I will initially place the OCTOwatrix with the cotton pliers, just making sure I get it below that cut margin of the proximal box. Now, once I've initially inserted it, I can go in and I can kind of push back the cheek and support it with my thumb as I insert it.